My name is Greg Sanders. I am a cardiologist. I'm also a software developer. Not two things you usually see together. The workflow of a doctor is subtle. It's unique. And I think one of the benefits of using software designed by a doctor is that you get somebody who understands your world and has built the workflow into the tool with that proprietary knowledge. HybridChart is a software platform for doctors who round outside of the practice, organizing your rounds, capturing charges, secure communication, and discharge management. All of this is rolled into the tool in a strategic, effective way that maximizes physician efficiency, maximizes productivity and profitability, and seamlessly connects to your hospital and to your electronic health record. Any physician who's rounding at hospitals and spending time in the office, they all have the same challenge. The challenge is, how do I organize rounds across multiple facilities? How do we communicate effectively? How do we get charges back to the people who are doing billing? Because there's usually a disconnection. My practice was losing tons of revenue just based on using a paper system. When we adopted HybridChart, everyone's revenue went up 10 to 15% because we just weren't missing charges anymore. Turns out I was wasting hours. We were doing sign-outs that were lengthy and clunky. And I think one of the big misconceptions when you bring in software is, hey, you're giving me more things to do now, thanks. No, we're going to give you very targeted things to do that take 3 seconds here and 3 seconds there. So it's not an addition to, it's an instead of. And so physician efficiency and physician satisfaction in general starts to go up dramatically. Traditionally, there's a disconnection between inpatient and outpatient worlds. That's where a lot of mistakes happen. That's where a lot of patients get lost in the shuffle. The basic essentials that you need outside of the office are census management or organizing your rounds, charge capture, seamlessly integrated with your EHR, secure messaging so everyone can talk to each other in a secure, HIPAA-compliant way, and discharge management, the game changer, which bridges the gap between inpatient and outpatient, helps patients get the right follow-up in a timely manner. Census management is a bigger challenge than most doctors realize, and you need an organized system to help you through it. There's a lot of moving parts. There's patients coming and going. There's doctors that are rounding at different times of the day. And it does require a sophisticated solution like HybridChart to organize the rounds, make everybody instantly efficient, make sure the right hospitals get the right attention at the right times and on different days, depending on how busy they are, depending on how many patients are coming and going at those different facilities. And most doctors don't do a great job of organizing it because it's hard. Charge capture is one of our core features. Charge capture is generally a problem when you're not in your office because, again, you've left behind your billing software, you've left behind your EHR, and nobody out there in the hospital works for you. So the responsibility for the doctor, if they're using a paper system, is to document what charges they did on which patients, carry around piles of paper, make sure that those papers are complete, which they usually aren't, get all those papers back to the billers. The billers then have to manually type these things into an EHR or practice management software. It's just an awful clunky system, and there are multiple breakpoints where charges can get lost. Bring in HybridChart. The charge capture experience is measured in seconds. Very intuitive. It's real time at the point of care. 2-3 taps on your phone, your charge is in. And now you have a point to reconcile against also. You can look at an entire admission, scan it for any gaps, fill in those gaps, and you can follow it electronically through the entire process. The need for secure messaging in a healthcare setting is obvious. You can't be breaking HIPAA laws. The problem with most of the platforms for secure messaging is that they're standalone. People can get siloed out of those conversations. So here at HybridChart, we do secure messaging totally different. Think of each patient having their own chat room that everybody can talk about them. And everyone has visibility for all the conversations, so nobody gets siloed. We don't want you typing lengthy messages. That takes time. What we do is we plant strategically secure messaging in the process, so we already know when you're going to want to send a message, and most of the time we actually compose the message for you. You can tag different people so that they get alerts. but the process of this patient-centric secure messaging really speeds up. And then the exciting part for me is watching practices really open up communication where there wasn't any in the past. Discharge management is one of those things where everyone asks, why are you doing this in HybridChart? It turns out it's one of the most important parts for improving patient care, reducing hospital readmissions, and really improving the overall efficiency of healthcare in America. In a traditional system, without using HybridChart, the onus falls upon the patient. If you do it the HybridChart way, everything gets flipped around in a good way. The doctor, in 3 taps, can arrange all their follow-up and can arrange what types of services do they need upon follow-up. And now the staff can proactively call the patient. So now it's not the patient's responsibility. Now the staff are proactively calling the patient. Patients don't get lost to follow-up. Patients don't get readmitted. Patient satisfaction goes through the roof. Staff satisfaction goes through the roof. This is the way it's supposed to be. HybridChart found all your bottlenecks, help you remove them. And so now practices can grow and scale in an efficient way. At HybridChart, you can get started very quickly. We can train a doctor in 28 minutes. Most of the time you can train yourself because it's so intuitive. We can get a practice onboarded in a matter of weeks without a lot of disruption. HybridChart is easy. We're gonna roll it out. We're gonna train everyone in your office. How you get started is you need to see it. Embrace a modern approach to rounding. Go online, schedule your demo today, see it for yourself.